Hi and welcome to Taft Aesthetics. Today we'll be performing a TMJ treatment on a client who suffers from severe TMJ. TMJ stands for temporomandibular joint, and when there's dysfunction of this joint, it causes severe headaches, mouth pain, and pain with clenching, biting, and chewing. Prior to any procedure, we always start with a consent form. The consent form protects you, the client, as well as myself as the injector. It gives possible side effects, contraindications, and what to expect after the treatment. Here we're going to be drawing up the neuromodulator of choice, and today that is Jeuveau, even though any neurotoxin can be used for this area. Typically for a client with TMJ, we're using anywhere between 15 and 25 units per side or more. For this particular client, we use 15 units for each side. Here I'm cleansing the area to be treated. I use Purison as well as a gauze to do this, and typically I'm cleansing 2 to 3 times per the area treated. And here I'm identifying the landmarks that we're going to be using to identify the area that we'll be treating. So here's the risorius muscle. This muscle is responsible for the smiling, so you want to be very careful not to get any neurotoxin or neuromodulator into that muscle. And the muscle we're trying to target is the masseter muscle, which is a really big muscle that runs right in front of the ear. So here I'm marking it out by having her clench and release, and I'm putting a line right in front of it. Now, if you see here, the risorius muscle, it runs through there, and it has some muscle fibers that actually attach to the top of the masseter. So you want to be, or the front of the masseter. So you want to be careful not to inject in that area. So here I'm identifying the landmarks with her clenching, and as you can see, I'm making my my points exactly where I'll be injecting. And now we're going to begin the injections. I have the patient clench during the injections, and then I go deep into the muscle and I retrograde inject as I'm coming out of the muscle. And I'll do this in those 3 locations. During this portion of the procedure, you may experience some mild discomfort at the injection sites. And now we're moving to the other side. Again, I'm cleansing the area with the Purison as well as the gauze. And then you're going to see me identifying those landmarks once again. Again, the risorius muscle. So I'm drawing a line from the oral commissure to the tragus, marking out the actual masseter muscle, and going about a centimeter behind that to avoid hitting any of those risorius fibers. Here we are injecting again. So again, it's a deep muscle, so we're injecting deep and retrograde injection on the way out. And you can see that in each of the locations. Some things to expect after TMJ treatment. You may have some soreness at the area, some discomfort, as well as some swelling. Feel free to use ice packs in the area. That'll help, as well as Tylenol. You'll begin to feel relief from your symptoms of TMJ within a few days, up to a week. But you won't notice the cosmetic difference, which is slimming of the jawline, for about 2 to 3 weeks. But the results of TMJ treatment last about 3 months.